Okay, so we are going to start with counseling stations. Before we start with those counseling stations, let me tell you that counseling station almost cover 30 to 40% of your entire PLAB course. So these scenarios and these stations are a bit different from history taking stations, because here is where your IPS is judged and where they check that, okay, uh, that how do you perform your duties in a daily life? How do you interact with the patient when a real patient or certain situation comes to you in a in your life? So how do you interact and how do you react in such situations? Because you will be dealing with different scenarios, including breaking the bad news, and there may be some medical errors where you have to explain the errors to the patients and or to the relatives, and also you have to tackle angry patients as well. And there might be some stations where the patients or the relatives might be unhappy with the uh, hospital staff, or the maybe there are certain scenarios such as culturally competent, where you have to interact with LGBT groups. Okay, so there are certain other scenarios where you will be counseling patients regarding the healthy living, and also their dietary modifications, exercise, and all those things. So all these things come under the counseling section. So today we will be discussing breaking the bad news, medical errors, angry patients, and also approach to the patients who are angry or unhappy with the hospital management. Okay, so we will be covering all those topics today. So let's begin with the breaking the bad news approach. Okay, so whenever you know the approach, how to approach a station, and it becomes very easy for you that how you perform in that station, and how to, because if you have that background knowledge, you have that approach in your mind, you can go with any scenario, you can deal any patient, either is a difficult patient or it's an angry patient or a patient who is upset or the patient who is disappointed, so you can deal with them. Okay, so we are going to discuss the approaches, and most of the scenarios, for example, intracerebral hemorrhages and RTAs in children, and also post-op bleeding or stroke, they are pretty much similar. They will be following, we will be following the same approach throughout the stations. Okay, and there might be some difference in the questions that relatives may ask you. Okay, but the rest of the stations and rest the approach is same. Okay, so let's begin with our first approach, that is approach to breaking bad news. All right, so we have a protocol called spikes protocol. It is basically an acronym which stands for settings, perceptions, invitation, knowledge, eve protocol, and then strategy and summary. Okay, so let's begin with settings. So setting is mostly the area or the environment that is provided by GMC, that is PLAB2 already prepares that area. And what you need to do is, okay, before we begin with it, so this is the station, or these are the stations where I mentioned before that they will be checking your IPS. So your IPS is going to give you highest marks in those stations. If you are going to perform well here, those are the real station where your IPS is judged. Okay, so you can get the highest marks in those counseling stations, even if you do not have that knowledge in your mind, but you have the basic theme, and you can, god forbids, if a scenario comes that has not happened in past many years, okay, there might be a new scenario, So if you have that basic approach in your mind, you can tackle it. But the thing that matters here the most is your IPS, the way you talk to the patient, the way you handle the patients, how do you tackle them, how do you address their concerns, okay? And also your IPS includes everything. The moment you enter the door, okay, the moment you enter the cubicle, you open the door, you enter the cubicle, and the moment you leave the cubicle by closing the door behind you, you did everything, whatever you do, whatever you perform inside, that is your IPS, your expressions, your speech, your tone. Your tone matters a lot in those scenarios as well, because there are scenarios where you have to deal, you have to break a news to a patient's relative that a patient is going to die. We are not expecting them to recover, or they are at the verge of dying. So how you are going to disclose this news to the patient's relative, because there will be emotions from the relative side, so you have to deal with them as well. So your tone matters a lot, how you will be raising your tone, where you have to raise your tone, where you have to lower your tone, okay? So settings. So you need to prepare yourself, anticipate emotions, because emotions are natural thing. They might come from the side of the patient's relative, that okay, there might be a relative, a mother or a wife asking about, they may be anxious about their child, or maybe anxious about a wife is worried about her husband. So you have to anticipate the emotions, that okay, what's going to come from their side, you have to deal with it. So introduce yourself, check the identity, and then check the relationship with the patient, that okay, how they are related to the patient, and use the patient's name. And then sit down. Do not disclose any news while you are standing, because it doesn't look good. And if you are going to break a bad news that has come all of a sudden to an attendant or a relative, so you cannot disclose it while standing. It does not sound good, okay? So you need to sit down, be calm, make eye contact, be loud, have energetic voice that is clearly audible, okay? Check for support. You have to ask the patient's attendant, okay, whether you are here on today, are you here on your own today, or would you like someone to be present by your side for this discussion or for this conversation, okay? You have to check for support. Whether if the patient themselves are coming to you, you have to discuss the results with the patient, then you have to ask for support. Or if an elderly patient is coming to you, you have to ask for support, okay? And in case if the relative is patient's husband or son, so you can ask them as well, but it's fine if they don't need any support, so it's fine, okay? So approach to the patient, this was approach to those patients who are sitting calm, or who are sitting, they are waiting for somebody to come, some doctor to come and talk to them and disclose the news to them, okay? But most of the time it happens that the relative, before the doctor enters the room, the relative jumps over the doctor and says, okay, starts the conversation and says, okay, doctor, please tell me, how's my husband, how's my child, okay, how's my mother? So you have to be ready for that as well. So you have to follow the second approach to a patient who asks question before you can introduce yourself. So here you will skip perception and invitation, okay? Because they've already asked you, okay, tell me. So there's no need for invitation. Okay, is it the right time to ask for, is it the right time to discuss about your child's condition or your husband's condition? No, you have to skip this perception and invitation. Then you have to give a general answer. And before that, what you need to do is you have to say, okay, I'm sorry, I beg your pardon. Can I confirm a few details before we discuss about your husband's condition, your wife's condition, or your child's condition, okay? And then introduce yourself. Okay, by the way, my name is Dr. Rahman, and I'm one of the doctors working in this department. May I confirm your name, please? So how you are related to Joshua, or how you are related to Mr. Ali, or are you Mrs. Ali? Okay, so you can introduce yourself. like that, and ask the patient's name and ask their relationship with the patient. And then if they are sitting, ask them to sit down and then give a general information. Okay, so as your son was brought here, so at the moment, unfortunately, your son is not doing very well. He is in the same situation as he was brought to the hospital. Okay, that's a general answer. So at the moment, your child is not doing very well. He is still in the similar situation when he was brought to the hospital. And then go into the details and narrate the events, and in between you can take the history as well. Okay, so we are done with the settings. And there are two types of approaches. Okay, approach to a patient who is sitting calm and waiting for you to disclose the news, and approach to the patient who jumps over before you introduce yourself. It was setting. Okay, and then perception. Perception is basically, you can take it as, you have to take a brief history in this part, because you have to check that how much does the relative know about their patient. Okay, so you have to check their understandings, ask them what they already know, look for signs of denial. For example, if you discuss a result with a patient of HIV positive patient, you have to discuss that HIV positive report with the patient. The patient might say, "Oh, doctor, how can that happen to me? Oh, can you please confirm that results? Oh, doctor, it can't happen to me." So you need to check for signs of denial as well, and look for gaps in understanding. Here you have to check, and there are some questions that can be useful here. These are, so okay, what do you understand about your condition, or what did the doctor tell you about your condition, so that we both understand the same thing. Can you tell me what have you been told so far? Okay, has anybody explained the results of the investigations to you? Can I ask, what made you come and see the doctor in first place? Basically, you are taking history, you have to dig out the knowledge, you have to dig out the information from the patient, that okay, what prompted them to come to the hospital. Okay, did the other doctor tell you why they requested investigations? Is there anything you were expecting from the results? And then take a short history about incidents or symptoms when necessary. Okay, were you there when incident happened? Were you there when he collapsed? Did she have any problems, or did he complain of any symptoms such as headache, dizziness, nausea, vomiting, any fits, whatever maybe? Okay, and then invitation, to give the patient a chance to know about the conditions. Okay, so you can ask the questions that are useful here. You can ask, okay, are you ready for us to discuss the results today? Is it the right time to talk about your father's condition, your husband's condition, or your child's condition? Okay, do you want me to talk about your test results now and explain what I think is going on, or would you like to arrange another meeting for it? Okay, so you have to check, you have to ask for, basically you ask for permission, or you have to signpost that, okay, I want to discuss the results with you, but are you ready for us to discuss the results today? So then knowledge, you have to explain the facts, avoid medical terms or medical jargons. Okay, use layman's terminology so that they can understand it clearly, because it's a serious news. It's a very big news that you are going to break to the patient's attendant or the relative. So you have to be very clear so that they should understand the severity of the you can say illness or the disease or the complication or the surgery. They might know, they must know it. Okay, or if they don't understand the severity or nature of the illness, they might say, okay, doctor, all right, so now I'm going to the work, I have work, you can call me. And they might not be able to perceive things the way you want them to know. Okay, so you have to be very clear, and then you have to fill in the gaps between the conversation that were in perception, and then give some information. Are you following me? Then give some information and then check. It is called basically chunk and check. Give some information And after that, check, okay, are you following me? Am I clear so far? Okay, am I making sense? Am I clear so far? And so on. Okay, but don't give little information. Okay, you just discuss. Okay, doctor is telling to the patient, okay, your husband was brought in an ambulance to the emergency department. Are you getting me? No, you should tell the patient's attendant, okay, as you already know that your husband was brought by an ambulance in the emergency department, and we did some quick examinations followed by a scan, and the scan, the news that we received from the radiology department in terms of the scan is not good. Okay, so are you following me? Am I clear so far? You have to ask these questions. If you feel the patient is not following, so then you can ask again. Okay, you have to chunk and check, give information and then check understanding also, that what you have already told the patient, do they understand it or not? You can ask them at the end, okay, can you please repeat after me, or can you please repeat it for me? Okay, and then use a narrative approach from the time, narrate it like a story. Okay, that from the time the patient came to the hospital, the symptoms with which the patient presented, and the investigation that were done in the hospital, followed by the diagnosis, and then the diagnosis basically breaking the bad news. So give a warning shot. I'm afraid your condition looks more serious than we thought. The news is not as good as we had hoped. Okay, never say that we have a bad news for you. No, do not use this word. Never use this word. Okay, use these words instead, that okay, the news is not good. The results of your investigation or your scans are not good. Unfortunately, I have got some bad news to tell you. No, it's a wrong sentence. Do not use this sentence. Okay, I'm going to cut this sentence that has been written over here. Do not use this word, bad news. Just say, okay, unfortunately, I do not have a good news. Okay, I'm sorry to tell you that your husband is going to die, or he has sustained a major bleed in his brain, or your child has sustained a bleed in his brain. You can break the news like that. Okay, review by the specialist, and then you have to tell, okay, what the specialist told you based on the scan results. You have to involve the specialist. You have to say on behalf of the specialist that, okay, specialist, they are of the view that we are going to do this. And then the patient attendant might be they might be you can say they will be worried, and they might start crying even. Okay, so then you have to use Eve protocol. Eve protocol means you have to explore the emotions, validate the emotions, and be empathetic in responding. Okay, so use open-ended questions. I can see that this has come to you all of a sudden. Okay, and I can see that this has come unexpected to you. I can see this is very distressing for you. Okay, you have to explore the emotions and then validate. I can only imagine that what you are going through. I can understand why you are distressed. And then empathetic response. I'm sorry for what you are going through. I'm sorry that this has happened. Okay, you are not saying sorry that something has happened or some mistake has happened on your behalf. No, you have to show empathy with the patient. You have to respond empathetically. So that's why you are saying that, okay, I'm sorry for what has happened. Okay, don't give false reassurance. Never ever do that. That okay, your patient will get better, and okay, we are doing this and he will get better and he can go home, whatever. No, never give false reassurance. Okay, everything is going to be okay. No, do not use this word. Use Eve when the person is ready to speak, not while they are crying or while crying. Okay, there's a part of IPS that when a patient is crying, do not touch the patient. Do not try to touch the patient or to console the patient. Okay, no, just ask the patient, okay, do you need a tissue paper? Just take a box of the tissue there. You've been provided with the tissue papers, and then what you can do is you can pick up the box and place it close to the patient. Okay, if they are crying, or if the patient says no, I don't need it, okay, whatever, or if they do not respond, then you can do it. And even if the patient still crying, and then what you can do is you can ask for a glass of water. And what you need to do is you have to fill a glass of water, or you have to take water and just keep it near to the patient. Okay, do not give it in patient's hand, but there should be some gap in providing tissue and glass of water. Do not be in a hurry to provide tissue paper followed by okay picking up a glass of water and keeping it close to the patient's attendant. No. Okay, your response should be natural, your emotions should be natural, it should sound natural. Okay, and then comes the strategy and summary. Strategy is the medical plan, what the consultants have decided, whether they are going to operate, whether they are going to perform further investigations, or the palliative treatment will be provided, or they will be arranging follow-ups. For example, in case of CA, breast, or some HIV test results. So what you can do is you can follow up, you can do further investigations, you can follow up, arrange follow-ups for the patients. Okay, and in case of patients who are not going to get better, or we are not expecting them to show any recovery, so what we do is we can put them on palliative therapy, or in patients we can go for surgeries as well. For example, there is post-op bleeding or extradural hematoma, we can go for surgery. Okay, you have to tell that what is the next plan, what is the next line of management. So then summary, you need to discuss the main points. Again, if you have got time, you have to discuss the main points starting from the beginning. Okay, that as you understand that your husband was brought here and by ambulance, and we did a scan of his brain, and the brain scan of the brain revealed that he has suffered, or he has sustained a massive bleed in his brain. And the neurosurgeons or the brain specialist. Okay, neurosurgeon is a medical terminology, you can simplify it by saying brain specialist. Okay, the brain specialists are of the view that the nature of the bleeding is so severe that they are not expecting your husband to show any recovery, or they're not expecting your husband to get better. So a team, multidisciplinary team, where a team of different doctors sit and decide what is next best step or best thing for the patient. So it has been decided that your husband will be provided with palliative therapy. Okay, so you know what is palliative therapy, then you can tell the patient's attendant that okay, this is a type of therapy in which we provide any supportive treatment to relieve the sufferings and distress of the patient. Okay, and then if you have any questions, you can find me, and then at the end you can say okay, if you have any questions, you can find me or any other nurse or any doctors. So they can discuss, you can discuss any questions with them as well. Okay, and what you need to do is if the patients patients attendants insist on seeing their patient, so you can arrange for them to see their patient as well. Okay, so let's go and start with a scenario. We will be quickly going through the scenarios because we have a lot to cover today. So basically you have got a main idea, because I discussed this approach in detail so that you should be able to memorize, and you should have those main points in your mind. For every scenario, you should have those main points, the spikes protocol for breaking bad news. You should have it in your mind, so that whenever a scenario comes, whenever you read a scenario, okay, it comes to your mind, okay, it's a breaking bad news, and you should be ready that okay, what I have to do, whether I have to start with approach 1 or I have to start with approach 2. Okay, so how the patient is how the attendant is going to react, what will be my emotions. Okay, so what will be my answers, how I will respond to those emotions. Okay, so let's discuss a scenario, and after that, you can ask questions as well. If anything is unclear, then we can discuss it. Okay. Okay. All right. So you have been provided with a scenario over here, intracerebral hemorrhage. You have to talk to the wife. Okay. You are an FI2 in accident and emergency department. Mr. Ali, aged 78 years, has collapsed and brought to the hospital with loss of consciousness by an ambulance. The initial survey has been done. The CT scan has been done and shows a massive intracerebral bleeding due to ruptured berry aneurysm. So the neurology team has seen the patient and reviewed his CT scan. They decided that surgery cannot be done. He is now breathing independently, unassisted. Patient is unconscious. Talked to his wife, Mrs. Maria Ali, explained that her husband's condition and address her consent. Patient is in terminal condition and only palliative care is possible. Patient's wife does not know about her husband's condition. Okay, so you can expect here a type 2 introduction, because the moment you will enter the room and she does not know about her husband's condition, but she knows that her husband has been brought to the hospital by an ambulance. Okay, so she's there to meet you, to discuss with you her husband's condition, and maybe it is you will get type 2 introduction, or sometime the patients or Mrs. Ali will be sitting calm. She will be waiting for you to come and discuss things with them. Okay, and then we will be following the same approach. We will be starting with the setting that is provided by PLAB 2 GMC. Okay, and here the findings are the diagnosis of the patient is berry aneurysm, ruptured berry aneurysm. So you should know these points, that how to explain these points, how you will tell about neurology team. You will say the brain specialist, okay, and berry aneurysm. You have to how you will tell. We will be discussing it shortly. Okay, so approach will be the same. Spikes protocol: setting, perception, invitation, knowledge, emotion, strategy, and summary. Okay, and there are some questions on wife's part. She's going to ask you that, okay, are you giving up on him? How long does he have left? Why did it happen? Can you take him to the ITU? Can I take him home? Okay, so you will be able to answer all those questions. Okay, let me tell you that the information which you already know. For example, you have been told that there is a ruptured berry aneurysm. You have that in mind, but you have to take some history for it. Once you have taken the history, then you will be able to answer all those questions. But if she's asking, okay, how long does he have to live? How long does he have left to live? Okay, and then this is a general question, so you can answer, because you are a doctor. You can answer this question. Okay, at the moment, I'm sorry. At the moment, I do not know. I'm not really sure about it, but I'm going to ask my senior. I'm going to discuss it with my senior. Or at the moment, it is difficult to say, but I can consult my senior and get back to you with the answers. Okay, you can give a general answer like that. And it has been given that in the scenario that he is breathing spontaneously or breathing independently. So can you take him to the ITU? You can answer this question as well. If you haven't taken the history or general question, so you can answer those general questions. The idea is that whenever there's a general question, you have the knowledge in mind, you can respond, you can give the information to the attendant or the relative. Okay, so let's start with it. So what you will do, you will start with type 2 introduction, because somebody jumps on you and then ask you a question. The first thing you need to do is apologize. I'm sorry, I beg your pardon. I would like to check a few details before we discuss about your husband's condition. Or can I check a few details before we talk about Mr. Ali? Okay. And then you begin. Okay, the attendant might say, okay, doctor, please tell me what's wrong with my husband, or how is he doing now? You can just give a general answer by saying, okay, you have asked for apology, you apologize, and then you have introduced yourself. Okay, by the way, I'm Dr. Imam, one of the doctors working in this department. May I confirm your name, please? Could you please tell me how you are related to Mr. Ali? Okay. So you have to confirm. You have already been given here that Mrs. Ali, Miss Maria Ali is there. So you have to confirm it. How you are related to that? Okay. Are you here on your own today? And are you here on your own today? You need to ask for support. Okay. And then give a journal answer. Okay. Miss Ali, at the moment, Mr. Ali is not doing very well. Unfortunately, he's in the same situation while he was brought to the hospital by ambulance. Okay. And then you can go to the perception. Okay. I understand that then she might sound she might be depressed or she might be upset. Okay. And then you have to wait for some time and then you can say, okay, so I understand that he was brought by an ambulance. Can you tell me what happened? So he collapsed. Basically, you are going to perception. You need to take history and then you have to take history. Okay, so he collapsed at home. Can you tell me what happened? When did he collapse? What was he doing at that time? Okay, and did he wake up at uh, during this period when he collapsed? Okay, what did you do after that? Has this happened to him before? Any other medical problems? Sorry, something's going wrong.